Have you ever really thought about the power that's just hidden inside your own skeleton? I mean, our bodies have this absolutely incredible ability to heal. And honestly, nothing shows that off more dramatically than a broken bone rebuilding itself. It's a total biological marvel. So let's get right into it.
Yeah, breaking a bone is, well, it's a pretty jarring experience, right? But what's fascinating is that underneath all that pain and chaos, there's this incredibly complex, perfectly timed healing process that just kicks right into gear. So that's what we're going to do today. We're going to break down that exact process from the very first snap all the way to the final seamless repair.
All right, so here's the game plan. We're going to start with the moment of the break, then get into how doctors actually decode the fracture. After that, we'll look at their playbook for fixing it, dive into the body's own amazing rebuilding blueprint, and finally talk about the road to recovery.
Okay, let's start at the very beginning, the moment of impact. To really appreciate this whole healing journey, you've got to understand the initial trauma. So, when a bone breaks, it's not just any old injury. It actually falls under a pretty specific medical field called traumatology. And this isn't about, a scraped knee. This is the big stuff, the specialized science of repairing major physical damage, the kind that happens from sudden, really forceful events. And what is a fracture, really? At its most basic, it's just a break in a bone. But don't let that simple definition fool you. It covers this massive range of injuries, everything from a tiny hairline crack you might barely notice, all the way to a bone that's been completely shattered into pieces. Now, our bones are incredibly strong, so it takes a lot of force to actually break one. It could be a sharp, direct blow, like in a car accident. Or it could be an indirect force. Think about landing hard after a fall. The impact is on your feet, but you could fracture a bone way up in your leg. Then you've got crushing forces, like a heavy object falling on you. But here's the one that always gets me. Even an extreme muscle contraction can be so powerful it literally snaps a bone. And of course, sometimes underlying diseases can weaken the bone so much that it breaks from very little force at all. That's what's called a pathological fracture.
All right, so you've made it to the doctor. Now what? Well, they have to figure out exactly what they're dealing with. And to do that, they have a whole specific language just for decoding fractures.
Okay, one of the first things they need to figure out, and this is absolutely critical, is whether the fracture is open or closed. A closed fracture is what you probably picture. The bone is broken, but the skin is still intact. But an open fracture, that's when a piece of the bone is actually punched right through the skin. And that is way, way more serious because that protective barrier, your skin, is gone, and the risk of a nasty infection just skyrockets. Next up, is the break complete or incomplete? The best way to think about this is like breaking a twig. A complete fracture is when that twig snaps clean in two, or even more pieces. But an incomplete fracture, that's when the twig just kind of cracks or bends but doesn't break all the way through. You see this a lot in kids, actually, because their bones are a bit more flexible. They call it a green stick fracture, just like a young green twig.
What's really cool is that the pattern of the break tells a story. It gives doctors clues about the kind of force that caused it. So a straight line right across the bone, that's a transverse fracture. If it's at an angle, that's called oblique. A twisting injury often leaves behind a spiral fracture that literally wraps around the bone. And then there's the comminuted fracture. That's when the bone just shatters into 3 or more pieces, which usually means a really high-energy impact.
So the doctor has it all figured out. They've diagnosed the break, they understand the pattern. What's the game plan now? Well, they follow a pretty clear 4-step playbook to manage the injury and get it on the path to healing.
And it makes a ton of sense when you lay it out. First up, first aid. You gotta make sure the patient is safe and deal with any immediate dangers. Step 2 is something called reduction. That's just the fancy word for putting the bones back in line. Step 3 is immobilization, holding everything perfectly still so it can heal up. And the final step, step 4, is rehabilitation. All that physical therapy to get you back to normal.
So, that second step, reduction. What is that? It's basically the medical term for setting the bone. If the broken pieces have shifted, you have to get them back into their original position. Sometimes a doctor can do this just by manipulating the limb from the outside. That's a closed reduction. But other times, it's going to require surgery to get in there and line things up. And that's called an open reduction.
And once the bone is set, you have to keep it from moving. That's step 3, immobilization. The bone fragments have to be held perfectly still to heal. Now, the most common way to do this is, of course, a good old plaster cast or a splint. But for more complicated breaks, doctors have a few other tricks. They might use traction, which gently pulls on the limb to keep the bones aligned. Or they might go in with surgical hardware. We're talking screws, plates, and rods to fix the bone from the inside. And in really severe cases, they might even build a frame on the outside of the limb to hold everything steady. Okay, so the doctors have done their part. They've set the bone, they've locked it in place, and now the body's own amazing construction crew takes over. This, right here, is where the real magic begins, as the bone starts to rebuild itself from the inside out. The body follows this amazing 4-stage blueprint. Right away, within minutes to days, a big blood clot called a hematoma forms around the break. Think of it like a first responder. Then, over days and weeks, the body starts building a soft bridge of new tissue called a callus to connect the two ends. After that, from weeks to months, that soft callus starts to harden into real bone. That's consolidation. And the final stage, which can take months or even years, is remodeling, where the body sculpts that new bone, trimming away any excess until it's back to its original shape. It's incredible. And that gets right to the heart of that final, amazing remodeling stage. It's all done by this tiny, microscopic construction crew. You've got these cells called osteoclasts. They're the demolition team, clearing out all the old, damaged bits. And right behind them are the osteoblasts. They're the builders, laying down new, strong bone. This whole process of breaking down and rebuilding is so efficient that over time, your entire skeleton gets replaced. It's wild to think about, but roughly every 10 years, you've got a completely new skeleton. So this whole biological process is just incredible, right? But it doesn't happen in a vacuum. The road to recovery, how well and how fast you heal, really depends on a bunch of key factors. It really is a balancing act. On the one hand, you've got things that help the process along, good nutrition, great blood supply to the area, and of course, keeping that bone perfectly still. But on the other hand, there are major roadblocks. An infection is a huge one. So is poor blood supply, or if the broken pieces keep moving around. And yeah, things like your age or other metabolic diseases can definitely slow the whole thing down. So after all of this, the trauma, the diagnosis, the doctor's playbook, the body's incredible response, what's the number one goal? It all comes down to one simple word: union. That's it. Union is that moment when the broken pieces finally, officially fuse back together into one solid bone again. That is the ultimate definition of success. And how do you know for sure that you've reached that goal? Well, there's basically a 3-point checklist. First, there's no pain at the fracture site. Second, a doctor can't feel any movement there at all. And third, the final proof. The X-ray shows a nice, clear, solid bridge of new bone, confirming the gap is officially closed. When you step back and look at it, it's just an extraordinary journey, isn't it? From a sudden, violent break, all the way to a seamless, strong repair. The fact that our own biology has this detailed blueprint to rebuild something so solid, so fundamental, it's just remarkable. It really makes you wonder, doesn't it? If our bodies are built with this deep, innate capacity for resilience, what other parts of us might be just as unbreakable?